Exposure therapy is designed to be successful for clients. It's not meant to push you to your limits and break you. If I had panic disorder, which is a fear of becoming afraid to the point where it terrifies you, would I prefer to be on Xanax or would I go straight into exposure therapy? As a specialist, what would I pick? I would pick Xanax first, only if my symptoms are so debilitating that I am not functional. And then as soon as the Xanax started to take the edge off of that anxiety as needed, and any medication that's prescribed from your doctor, not just Xanax, but any type of medication for anxiety that can help take the edge off, I would first start with that if I had extremely debilitating panic attacks to regain functioning. As soon as I was able to regain some type of functioning, I would immediately start doing exposure therapy. Now, if I had panic disorder that was not intense and severe, I would jump right into exposure therapy. The reason is clients can gain significant traction in exposure therapy pretty quickly if the exposure is done by a competent therapist who understands exposure and response prevention. We as humans naturally desensitize to things, and that's the goal of exposure therapy, is to help you to desensitize to your triggers. And we can actually desensitize pretty quickly. Exposure therapy is designed to be successful for clients. It's not meant to push you to your limits and break you. So think of an exposure where you're doing something that you could normally do on your own, but you just don't do because you don't want to deal with the anxiety. And it's not that you can't handle it, you just don't want to deal with the anxiety. Well, exposure therapy typically starts by giving you those types of exposures until you completely desensitize to that trigger. And then you move to the next stage, and so on until you get to the biggest thing that you fear, which by that time you're going to be ready for it. I personally do exposure therapy in my own life just to maintain the gains that I've made with my own anxiety. So exposure is a way of life for me, and it is a method that I can use to prevent the occurrence of debilitating or distressing anxiety. So exposure is my preventative medicine to be able to help me to not have distressing anxiety problems. Whereas with medication, you're only focusing on your symptoms and you're not really developing any true therapeutic skills or experiences to be able to get to the core of your anxiety issue. It can actually get to a point where you're just simply chasing symptom reduction. And for a lot of clients, that can work until it doesn't work anymore. And then the symptoms are just not containable. And you just end up with a really, really chronic anxiety issue that you have zero tolerance for. Whereas with exposure therapy, you can actually over time get almost complete resolution with how distressing your triggers are because you are frequently exposing yourself to them. So as a specialist, if I had to pick between Xanax or exposure therapy with panic disorder as my problem, I would pick exposure therapy unless my anxiety was so severe that I needed to restore functioning, and I would start with Xanax and then move to exposure therapy. As always, guys, thank you for stopping by and take care.